what's going on with my camera. It is really, it's actually not a camera, it's an iPad, and it's stuck to a suitcase handle. And the image is really grainy and I don't know why. So please ignore that. It's been a while. It's been a while. I've been doing excellent physically and terribly mentally, which is what I want to talk about because and it's because I've been so down that every time I even think about making a video to document my next week, I'm depressed and I just don't want to do it. I don't want to do anything. But I did want to talk about it because it is one of the, I'm surrounded by animals. Trying to see my animals. This is Foofy. His name's Jupiter. He's my boy. Sorry, Foofy. I'll get my next baby. Gizzy, if you even think about that, I know what you're thinking. This is Gizmo. He's a mama's boy. He's the baby of the house. That being said, he's 2 now. Oh, you're a big 2-year-old. But you're still a mummy's boy, aren't you, hey? Every night he has to come, which is interesting given my injury. Since kittenhood, he's come and sat on my chest and curls up and sucks his thumb. He sucks his little finger, just like a baby. So, I don't trust him. Okay, I've just got my dog a brand new bed. And Gizmo seems to think that every dog bed is a kitty litter tray, don't you? I think he's been good, but he is sitting on it. Yeah, so after hospital, he tries to come up and sit on my chest, but I've not been able to let him. And it's always been his security blanket thing since he was a little. I just see one of my other babies. Hang on. Shishi, come here, boy. He's run away. So, I'm a vet nurse. Actually, I'm not vet nursing at the moment, but that is what I have been for my entire career. Cheeky boy. So I've got a lot of animals, and I've got 3 cats. They're all boys, and a dog, the Border Collie. A Border Collie is a great referee to have when you have as many animals as I do. They are the... Gordy, are you the best boy? For one, my dog saved me in a house fire heroically. But 2, Border Collies just know how everyone should be behaving. And if everybody's not behaving accordingly, they'll say so. And they're usually right. So Gordy's the referee for the cats. I've got 3 cats, a dog, a stick insect. It's actually my daughter's. 3 quails that we hatched from eggs in an incubator. 2 budgies, a guinea pig. I think that's it now. Because we've always had a million fish and lots of tanks, but we don't anymore. So having so many animals and being a single mum, it's been good and bad. It's been terrible because animals make mess and the floors need vacuuming and the litter trays need doing, and it's hard. But I've also been stuck at home, so having these guys as company has been good. My little Jupiter, the little black one, the huge black one I showed you at the start, he's my boy. He sits with me no matter what I'm doing, and he always just has to have his little paw stretched out and on your knee or on your arm or wherever he is. You're the best boy, aren't you? All right. I've been depressed. I've been really, really depressed, and I've been waiting for it to pass. I've been warned that heart surgery can lead to depression, and I just dismissed it until I felt it. And then I've been, so knowing that it's normal has been good, in that, okay, it's happening and it happens. What am I now? I think I'm week 5. Week 5 post Ross procedure of valve replacement surgery. But it's just hung around. I went to make a couple of videos and I just couldn't even, I just couldn't. And then I thought, I'll wait for it to pass, and it hasn't. So here I am anyway, and I'm just going to try and explain it, because it's actually quite baffling to me, in that the only time I've been diagnosed with depression is when I was actually, in hindsight, experiencing a heart failure. And I went to doctors. I just feel terrible. I've got no, I was trying to explain it. It's like I've got no mojo. I've just got no. When I get sick like this, when I started to get really sick, the interesting thing I noticed was that, and I listen to music all day, every day, but I stopped being able to listen to music or having any desire to listen to music. And I have zero interest in romantic interests, shall we say. So I always know that they're the first 2 things to drop off for me when I get really sick. And that does make sense, because your body just isn't interested in the in things like music and relationships. It's just too busy being sick. My body isn't looking to, I mean, apart from the fact that I'm 50, isn't looking to reproduce anymore. But it's the music thing that really got me, because I'll listen to music all day, every day, and then all of a sudden I can't. One, it starts making me sad that I can't do all the things that the music's singing about. But it's more than that, and I think it's actually a brain chemistry thing. I think it's a dopamine thing. I think you need dopamine to, as part of your drive. And when you've got no drive, the ability to appreciate music and stuff like that just isn't there. Anyway, that aside, I'm like, oh yeah, I was saying the only time I got diagnosed with depression was when I actually had heart failure. So I was put on antidepressants and I took them, thinking, okay, I'm depressed. And then they didn't do a thing. I gave it a good go. I went off them, and I wasn't depressed. I was actually really sick. And I guess that's why the antidepressants didn't work. But, you know, it happens a lot. And I don't know if it happens a lot for men in the same way that it happens for women. In that if you've got a medical issue, it's depression or anxiety, have a pill. I don't know. Maybe it does for men. I have no idea. It just feels like a woman thing. Anyway, So I'm like, what is this depression? Like, what's the root of it? Like, what's making me sad? And I really wanted to think about it because I really wanted to be able to describe it. And I've decided it comes down to two main things causing the depression. And the first one is being housebound for so long. Actually, I'm going to say three things. So being housebound, being unable to participate in life because you're stuck home healing and the world is going on and you feel left out. And I don't know about you, and different types of people are different. I was always what I would have said was an extrovert. When I go out, I am an extrovert, right? You'll get extrovert me. That's just Gordy responding to the dogs in the street. Gordy, come on, it's okay. Hop on your bed. Hop on your bed, it's okay. I've got it. I've got it. I'm onto it, eh? My boy. Shh, Gordy, please. Gordon. So, my dog's name's Flash Gordon. I didn't name him Flash Gordon. He was named Flash Gordon because he's litter. I want to show you him, but I cannot move this iPad. I will never get it back in that same spot. His siblings were all named after superheroes. And he was the last one to go because he's a predominantly white border collie. And they are always the last to go. And they used to, in fact, be put to sleep. There's 5 dogs walking past my house on a lead right now. And I'm just hoping to God, for your sake, that he doesn't see them. Oh, wait, there's nothing going on, Naughty. No, nothing's going on. You're a good boy. You should just relax and not look out the window for the next minute. Yeah, you're a good boy. Shh. You're the best boy. You're my best boy. Now I completely forgot what I was saying. Okay, 3 things. Can you quit it? I know you've got a job to do, but I'm very busy making a video. Body on your bed. On your bed. Just settle down. He marches over to me and sticks his butt in my face because he wants his butt scratched. That's the only thing that'll make him stop. So that's what I'll do. That's what I'm doing. When I say butt, I mean the back of his, Jupiter the cat. Oh my God, he's so beautiful. He's reached his foot out now and has that on the dog as well. So we're both massaging the dog's bum. And I wish I could show you, but as I said, I can't move this thing. So there's the missing out, stuck at home thing. There is the, oh my God, what has happened to my life and independence? Like, I've gone, when you wake up from the surgery, and for the first few weeks after the surgery, it is just so hard. It is so hard that you wonder what you've done and you wonder if it's worked. And I have not yet heard from my surgeon. Sorry, I'm not keeping up my butt scratching duties well enough. After I got out of hospital, right, I got a message saying, you're on the waiting list for a follow-up with the surgeon. And I got a message saying, you're on the waiting list for cardiac rehab. And I have not heard a thing since. It's been 5 weeks. So I started to get worried that, what if it hasn't worked? What if something's gone wrong? And when that set in, I really went there and got quite worried about it. So I went to the doctor yesterday, and I'll tell you about that in a minute. because you feel so terrible and you wonder if you're ever going to get better. It wasn't until week 4 where I started to go, wow, I can do stuff if I want to. I want to drive. I want to mow my lawn. I know I'm not allowed to do all those things, but the drive to do things was there. So the other day, I decided I'm going to the cafe, and I drove. And when I got there, it was just so amazing. I was like, oh my God, I'm out, and coffee, I'm a caffeine addict, and people. And it lasted for about 20 minutes. And then I was like, oh my God, I am so tired. I need to go home to bed. And even just the prospect of driving home to bed was a lot. But it's good to know that I'm starting to feel better. I'm still at that stage where I'm starting to feel better, so I do too much, which puts me backwards. But the getting better is there. And then I realized for me what the main culprit of my feeling depressed is. And it is outstandingly money. I'm a single mum. I pay a mortgage on my own. I've got a house, a roof to keep over the head of myself and my child. And it's damn hard when you can't work. Now, I haven't wanted to go into it too much, and it gets me upset even just thinking about it. And it will be different for everybody in every country, right? But I can't get financial support. You cannot get a disability support in Australia for anything like this. And you've got to remember, I've got severe, I've been bleeding for 6 months. I've got severe endometriosis that was about to have surgery. That's how we discovered I needed a heart valve. It was all in the pre-op stuff for that. I've got to have surgery to remove a tumour, basically, out of my uterus. And it's not cancerous, and they're quite common, but they're very painful and they bleed a lot. And then I've had this open heart surgery. So there is no work in sight for me. And yet I'm a sole provider, single mother, mortgage, with a fucking mortgage. So the threat of losing my house is enormous. And in Australia, in spite of everything going on, you cannot get any financial support. Because the most important question that a doctor has to answer to get you this support is the patient basically in the state that they're in post-treatment. Like they need to be in the final outcome of their health condition. So let's say I had all this done and then it went horribly wrong and I was not ever going to get a quality of life that was any better. There was no further surgeries to do. There's no more treatment to be had. Only then can you go on a disability. So even though I'm in hospital having my fucking chest reefed open and my heart operated on and I can't work and I've got mouths to feed, there's no help. Sorry the picture's so grainy. I really don't know what's going on there. There's no help. There's nothing you can get. Because where I'm at with my surgery is not where I'm expected to be in 3 months or in 12 months. I'm expected to make progress. I'm expected to get better. So we're not in, this isn't it. And that's a prerequisite of the disability support pension in Australia. God, it pisses me off. Don't get me started. you'd lose your house. And the only reason I haven't lost my house is because I have parents, my elderly parents, helping me. They're retired. They don't have... I feel so guilty. I cannot tell you how guilty I feel. I feel so fucking guilty. But I've had no choice because there's just no financial help and I need to pay my mortgage. I need to make this not lose me my house. And I've even had to do the whole... If I didn't have 83,000 animals, I would make myself feel better by going, okay, so if I lose my house, I'll buy an RV and I'll with my daughter and we can live in it while I get back on my feet. But you can't do that with a dog, 3 cats, quails, budgies, guinea pigs. So I've been in this state of not wanting to get any more animals for a long while because of this fear. Just really jostling with feeling bad that I want to be able to pay this house off and I want it to be for my daughter and I want it to be for our future. And it killed me to get it in the first place. And it's the first place I've got since breaking up from my 20-year relationship. So we split everything and each brought places. And then I got... So I've paid on mortgage before, for 20 years before this. But I'm on my own now. So this has happened right when, in my first, I've only been in this house a year and a half. And already, well, obviously, I can't earn money. And I've got to pay. It's heavy. And this is where the stress and the depression comes from. I've got to pay a mortgage on my own. I've got to pay all of the utilities on my own. I've got to pay for all the animals on my own. I've got to pay my daughter's bloody school fees. And I don't have an income. And the system in Australia can't help me. So for the first time in my life prior to surgery, I've been forced to go to food places. Like in Australia, there's something called Second Bite. And it's when basically all of the food that's threatening to be out of date goes from the supermarkets to Second Bite. And then they set up little stalls in suburbs and you can collect like a box of groceries. I've had some really interesting experiences and I'm a little bit scared to go back to some of them. Some of them involve heavy God talk. And if you know me, I respect anybody's right to believe in whatever they want. But I am not a religious person in any way. I don't even know what I believe. All I know is that I don't believe in the whole God Bible thing. And unfortunately in Australia, and it might be the same everywhere, the places that you go to get help are religiously operated. So part of the getting of the help is the listening to the God stuff. And yeah, look, I won't go into that too much in this video. It's a whole other thing. So I've never in my life had to do that. I've always worked. I've never had to get help like that. And now I desperately need help like that. But everyone in Australia is struggling at the moment. We're in the middle of a housing crisis and a cost of living crisis. So I'm not the only one going to these kinds of organisations for the first time. but my health has taken me there. And I'm just terrified that my health is going to cause me to lose my house. Now, I'm sure my family and everything won't let that happen. But it's when you've got to pay the bills and the mortgage, it's your problem, really, unless you ask for help. So thankfully, my parents have been able to help me so far. I feel terrible about it. Thank God I've got them. Yeah. Which brings me to how do I get through this stress-wise? Because my stress is... I can't even believe I'm dealing with this much financial stress going through something like this. And I am feeling a bit sorry for myself. But I see people going home from this surgery, right? They're retired and they've got their husband or their wife, or they're married and they've got a partner. To A, help them physically, and B, help carry the family financially through this kind of thing. But as a solo person and a single mum, I don't have any of that. So everything stops with me. I'm responsible for everything. My parents are elderly. They can't. My dad has dementia, and there's only so much you can put on your elderly parents, if you know what I mean. And in many ways, this has been harder for my mum than it has been on me. As in, my mum just worries so much. And when it's happening with you, hang on, I need to check that the cat didn't. He didn't win the dog's brand new bed. So I wonder what it's like for others out there. I wonder for anyone else who's had open heart surgery of any kind and the depression that you feel afterwards. What do you feel it's rooted in? Are you worried about money? Is it, for you, is it completely physical? For me, money's going to force me to be physical, and much sooner than it already has forced me to be physical much sooner than is advised. Because, yeah, it's just me. All of that being said, that is heavy stuff. It's mental side of things. Physically, I'm great. Well, I'm great, and then I'm not great because I do too much. My wound is healing. My body is healing. I still get really bad pain in my neck and shoulder blades from the whole of the chest thing. I still crack. I don't know if you heard that. I crack. My chest cracks, and it's hearable from people outside of me. So if you're next to me and I got to move and so I'm still waiting. I haven't heard from the hospital. It's been 5 weeks. I've not heard boo. I haven't had any follow-up. So what I did yesterday, because I needed a couple of scripts, is I went to the GP. Now, I'm a vet nurse. I know how to listen to hearts. I have a stethoscope somewhere here. And for the last 2 weeks, I've been deathly scared. I haven't been able to listen to my own heart because I had this sensation, and it was a sensation that I used to get before the surgery of sort of a whooshing sensation in my head. And I thought, shit, the valve has failed. And then I got really worried. I even said to my daughter, and I shouldn't have put this on her, I'm suddenly worried my valve, and worried her with that, which was stupid. It's hard when you're single and you've just got one other person there and you talk a lot to that person. And she just caught me in a, oh my God, I'm scared moment. So I've been too scared to listen to my heart. So when I went to the GP today, I said, yesterday, I said, I still haven't heard anything from the hospital or the cardiac rehab unit. Who knows when I will. I'm in the public health system in Australia. So the help is there, but you've got to wait for it. And hi Naughty, are you the goodest boy? Are you the bestest boy, dog? Alright, what was I saying? Shit, now I've forgotten. I've really forgotten. That was the last thing I was going to say too, so. Oh yeah, doctors. So I said, I need scripts, but I haven't heard back from the hospital, and I felt a weird sensation in my head that I used to get with my murmur. My murmur was so severe, it sounded like, when you have a heartbeat right, it's meant to be a really crisp beat. Boom, 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 boom. That's because all your valves are functioning, so they're closing off, pushing the blood, and opening and closing. My valve was the worst it could be. So there was no boom, boom. It was whoosh, whoosh. So it sort of sounded like a tide coming in and out. And that's what I was scared to hear again. That's why I couldn't put on my stethoscope. So I said, I think I'm being paranoid, but I haven't heard from the hospital and I'm freaking out a bit. Can you just listen to my heart and tell me if it sounds okay? So he listened to my heart and he said, and this is without me saying anything, he said, it sounds good, there's no murmur. And that just enabled me to breathe, because that's what I was worried about. I was worried I'd somehow ruined the valve. And that could be because I was doing too much, or because I'm just, it happens. The Ross procedure that I've had, it's quite normal to have to go back in and do revisions. The fact that I had such a terrible time in ICU, I'm so scared to go back there. So the thought of anything else happening to my heart, or them having to go back in for any reason, is terrifying. But he said it sounded good, and so that's a relief. I still haven't been brave to listen to it for myself. And I've decided that maybe it's best that I don't. When it's your own health, regardless of if you know heart sounds and things, you can make yourself believe anything, really. So if you're in a negative frame of mind, I'm just going to leave it to the professionals for a while, I think, and let them do the listening and the telling. And, yeah. So I think that's it. Physically, I'm good, week 5. Mentally, I'm shit, week 5. I've been shit for 2 weeks mentally. It stopped me from doing things, seeing people, answering my phone, having a life, even though I can't really quite have a life anyway. So yeah, that's the mental side of it. And I'm sure it's different for a lot of people. I know a lot of older people will have the financial security, but maybe they don't have the fast recovery that I've had because of my age. So for them, I think there's a real loss of independence. And I felt that loss of independence, and it has affected me. But I just noticed that in hospital, I was the youngest one there. And I just got up and walked as though the same way I walked in there. There was no unsteadiness or needing help. Whereas they're all sort of out on these walkers with the physio. The physio came to see me once and got me to go for one walk up a flight of stairs and said, I don't need to see you again. So I think that is part due to my age. And that's something to be grateful for. But I don't have the financial security that a lot of older people would have. So that's the battle for me. So I think that is it. I will definitely do a video next week, week 6, to let you all know how I'm going. Not that this channel is ever meant to be a heart anything. Yet here I am sharing my heart stuff. Maybe it will help somebody. My own experience has been when you research stuff like this, like the Ross procedure, for example, or heart valve surgery, I want to hear it from people who've had it. I want to hear about the patient experience. But what you find is all these highly polished, put out by the doctors, 10 things that can contribute to, it's just all bollocks, and it's not what I need or want to hear. I want to hear from the people. I want to hear from the people what it was like waking up from surgery. I want to hear from the people that have experienced what it's like to feel heart pain, angina. I want to hear from someone who's had the surgery what it feels like week 6. I don't want a doctor who's never experienced this personally to be telling me stuff. I mean, there's a place for that and all of that, but I think ultimately people going through it want to hear from people who've gone through it and are going through it. So yeah. You are covered in burrs, my kitty. Cats aren't allowed out in Australia. I don't know if it's Australia-wide. It's definitely where I live, because I live in a national park. But occasionally he gets out, and he got out last night, and he's come back covered in burrs, like little spiny grass seeds everywhere. So I'm just picking those off him. Anyway, that's it, everybody. I'm definitely starting to feel better, like I can do things. And I'm going to have to start doing things soon. And